right now, one of the most important issues is healthcare and health access for Latinos, particularly because our community has been disproportionately impacted. Although Latinos represent 18% of the community in the country, we should say the entire population, we now have about 36% of the count of COVID infections, and that's why this is so important. There's another subject also that has been high on the minds of people, and that is the opportunity for more women to seek office. We have seen much of that happening during this election cycle, even starting last fall and continuing to present. So I can tell you this, you will be seeing more Latinas who are seeking that opportunity to go forward in their respective communities. The other thing that we are also monitoring and will continue to work very aggressively in will be in providing hunger relief for our communities around the country. As a matter of fact, we have such a partnership right now with the Walmart Foundation, and we're going to make sure that we're nourishing as many communities as possible, thanks to their generosity and their support to make these kinds of programs happen. If you are not a member of LULAC, this is an opportunity to consider it. We are all volunteers. We are participating wherever we live in a way that can make us be effective. And also because we are part of a legacy organization, when LULAC knocks on the door of an elected official, we certainly have the opportunity to make an impact where we live, and that's the best way to do it, all across America and even in Puerto Rico. I give you now the League of United Latin American Citizens Chief Executive Officer, Ms. Sindy Benavides.
Muy buenas tardes, good afternoon. My name is Sindy Benavides, and I serve as the CEO of LULAC. It is a pleasure to welcome you today to today's program. I want to introduce our LULAC National President, someone who needs no introduction due to his bold leadership. Como todos saben, no le teme a nadie ni a nada. He is always on the front line protecting and defending our community. Con eso les dejo a President Domingo Garcia. Domingo.
Thank you, Sindy. And I want to welcome everybody watching throughout the United States and Puerto Rico to our LULAC program on COVID-19 and its impact on the Latino community, especially our young people. I personally know how difficult and how hard it's been. My brother, who's a Dallas police officer, got COVID-19 attending some of the protests. Luckily, he was able to just quarantine and not have any medications, but other people have not been so lucky. We have been to the plants in Greeley, Colorado, meatpacking plants, where 8 workers died, hundreds got sick. We were in Springdale, Arkansas, at a poultry plant, a Tyson plant, where also 4 workers died and hundreds got sick. And then recently we were in Clinton, North Carolina, at a hog processing plant where 4 people died and multiple got sick. And we bring in the issue that Latino workers are essential workers. 4 of every 5 Latinos are in essential jobs, construction. Representative Ruiz, me and you are both former farm workers picking cotton and vegetables out in temperatures that are 100 degrees and above. But we're not disposable workers. And we need assistance and help to help Juana's Quinceanera shop, or Lupita's Taqueria, or Juan's construction and landscape companies. They need the assistance and the help at a national level so they can continue going. And so hopefully we'll be able to find some answers from some great guests that we have today. It's my pleasure to introduce, again, a fellow farm worker, a fellow person who worked his way up to become not only a doctor, but a doctor who's been on the front lines going out in his community and giving COVID-19 testing to constituents there in California. He is Representative Raul Ruiz, Congressman from California. Raul.
Thank you, Domingo. It's wonderful to see everybody on the screen today, and thank you for that introduction. And thank you for all of you for being here. I'm Congressman Dr. Raul Ruiz, and I'll be your moderator for today's event. As was mentioned, I'm an emergency medicine physician trained in humanitarian and disaster aid. And I'm the son of farm workers from the Coachella Valley, and I represent California's 36th Congressional District. It's in eastern Riverside County in Southern California. And if you don't know, it was 120 degrees yesterday with some humidity, Dr. Biden. This is in the summer. It's pretty sunny here. I want to give a special thank you to Domingo Garcia, LULAC National President. for LULAC, the staff, and everybody for making this happen and for hosting, members of the media for attending, all the sponsors for this event, everyone far and wide for tuning in, and especially panelists, Representative Filemon Vela, panelist Amirah Sequeira, lead legislative advocate for National Nurses United, panelist Dr. Robert Rodriguez, professor of emergency medicine at the University of California, San Francisco School of Medicine, and of course, we have the honor and privilege of having Dr. Jill Biden with us here today. Dr. Jill Biden is a community college professor, a New York Times best-selling author, and the former second lady of the United States. Dr. Biden is a fierce advocate for military families and for community colleges. She has been a warrior in the fight against cancer and has dedicated her time and energy to expand educational opportunities for women and girls around the world. Today, she is working to help elect her husband, Vice President Joe Biden, to become the President of the United States. Please join me in giving a warm and proud welcome to Dr. Jill Biden.
Oh, thank you. Thank you, Congressman Ruiz. And Raul, you've been a critical voice in Congress in so many ways. And you have shown incredible leadership during this pandemic. And I want to thank you for all that you've done, but especially for bringing tests directly to farm workers in the Coachella Valley. And thank you to Domingo for your leadership at LULAC. Latinos are going to play a big role in this election. And we are grateful for your work lifting up so many Latino voices. So buenas tardes, and thank you to everyone for joining us today. I know that not all of you probably know me as well as you know my husband, Joe. So I'd like to start by telling you just a little bit about myself. I grew up the oldest of 5 girls in a suburb outside of Philadelphia. And when I dreamed of what my life would become, I knew that I wanted 2 things. A marriage like my parents that was strong and loving and full of laughter, and I wanted a career. So I set out to find those 2 things, but my path was just a bit meandering. It was the 70s. Vietnam, love beads, equal rights. I wore my hair down to the middle of my waist, and so did most of the men I dated. So one day I was asked out on a date from out of the blue. And that evening, a handsome young senator showed up at my door. So you remember the 70s, right? The bell bottoms and tie-dye. So I opened the door, and there stood Joe. And I took one look at his perfect suit and his leather loafers, and I thought, thank God this is only one date. Well, one date eventually turned into a marriage proposal. And if I'm being completely honest, it was 5 proposals because this was not really part of my plan. And more than that, it wasn't just my heart on the line. As many of you know, just after Joe was elected to the Senate, he got a call that his wife, Nelia, and baby daughter, Naomi, were killed in a car accident. His sons, Bo and Hunter, were seriously injured. And after all that they had lost, I knew that if I said yes to Joe's marriage proposal, it had to be forever. Eventually, I realized that my love for them outweighed any fears I had, and I said yes. And all these years later, I'm so proud of the life we've built with our sons and our daughter, Ashley. Now, I've been an English and writing teacher now for more than 30 years. In fact, I taught all 8 years we were in the White House. And my students kept me grounded and reminded me of why our work mattered so much. A few years ago, I had to tell my class that I would miss the next session for personal reasons. Now, my students have a lot of shining qualities, but boundaries are not one of them. So they immediately began shouting, Dr. B, where are you going? Well, my sister Jan was having a stem cell transplant, the first of her cancer treatments. And she would be isolated in a hospital room for over 6 weeks. And I tried to explain that to my class with as much composure as I could muster. But you know, the words caught in my throat. So I turned and I faced the whiteboard behind me, hoping to hold back my emotions. And when I turned back around, my entire class was standing. And they lined up and gave me a hug, one by one. And until that moment, I didn't even realize how much I was struggling or how much I needed their strength. There's such power in kindness, and it can pull us back to ourselves. It can build the bonds of community, and it can mend the fault lines of our broken hearts. And we see it all around us right now. This pandemic has been devastating, and that is especially true of Black and brown communities. Latinos fill essential roles throughout our economy, and they're facing some of the highest rates of job loss. And they are more likely to get sick and lose their lives to this disease. COVID has shined a bright light on the injustices and inequities that have plagued our nation for far too long. It's not right, and there are reasons to feel despair. Yet we have seen so many people rise to the moment, with frontline workers risking their health to save lives and keep food on our tables. We've seen people sewing masks and hosting food drives. We're finding new ways to connect with one another and support each other. And we deserve leaders with the same fortitude. Joe has released a bold plan to recover from this crisis, one that will help create millions of jobs and build an economy where everyone has the chance to get ahead. He's going to make sure the people who are on the front lines, working in the grocery stores, the healthcare, service jobs, have safe workplaces and free testing. He's going to make sure that schools can safely reopen. But he knows it's not enough to return to the status quo. We need to build back better than before. We need to tackle racial inequity in our education system and provide a path to citizenship. We need to make investments to end health disparities. Joe has the vision, the experience, and the character to deliver on those promises. And now he has someone by his side who will work just as hard, who has never been afraid to stand up for what's right or hold those in power accountable, Kamala Harris. And let me say how excited I am to have her husband, Doug, joining us as well. Now, I know our party hasn't always done enough to earn the Latino vote, and we've taken it for granted at times, and that's not right. You matter to Joe, and you matter to this campaign. Joe released a Latino agenda to address many of the challenges facing this community, and I want you to know, but I think you do know, that you matter to me. And that's why I've been holding charlas or chats with communities like yours across this nation. It's why I'm here today to hear from you. And if I have the honor of being your First Lady, I promise you this: I will dedicate myself to ensuring that you have a place at the table alongside me. So I want to thank all of you for being here today and sharing your stories. And I'm excited to take them back to our campaign. And now I'll pass it back over to Dr. Ruiz, who's going to get us started.
Thank you. Thank you very much, Dr. Biden, for your leadership, for your kindness, for gracing us with your presence, and for those words that bring hope for Americans, and for partnering with us on this important conversation regarding COVID-19 and its impact on healthcare and the Latino community. It is precisely now, during this global pandemic, when Latino communities are disproportionately getting infected and dying from COVID-19, that we must work to expand access to healthcare and testing, and to make sure that it's available to all communities throughout America. So thank you for all your work, all the work you've done and continue to do in helping Latinos and all communities of color get through this pandemic as quickly and as safely as possible. So now, also joining us today is Congressman Filemon Vela Jr., who represents Texas's 34th Congressional District in Deep South Texas, in Brownsville on the border of the Rio Grande Valley. Congressman Vela was elected in 2012. Prior to his election, he was an attorney for more than 20 years in South Texas. Congressman Vela serves on the House Agricultural Committee, where he is the chairman of the subcommittee on General Farm Commodities and Risk Management, and sits on the subcommittee on Commodity Exchanges, Energy and Credit, and the subcommittee on Livestock and Foreign Agriculture. He also serves on the House Armed Services Committee as a member of the subcommittee on Sea Power and Projection Force, and the subcommittee on Tactical Air and Land Forces. So Congressman Vela, my good friend, welcome, and I invite you to say a few words.
Thank you, Raul. It's been a pleasure serving with you since we were both elected at the same time. And Dr. Biden, thank you for joining us as well. Our journey began back at Christmas. We came down to Brownsville, Texas, and we crossed into Matamoros, Mexico, where we fed 3,000 victims of President Trump's MPP policies. So I've well begun to understand how compassionate you and Joe are, and I know that our country will be in a lot better place once President Biden and Vice President Harris take leadership of this country. We've got some great experts here on this panel that can really talk to us about, what they're seeing on the front lines with respect to the patients, the physicians and nurses that they work with. So I'll take my brief moment to talk real quickly about a couple of things. But first, the significance of the HEROES Act that Raul and I we support Speaker Pelosi's efforts. And for a lot of people, it may be a vague subject, but the fact of the matter is that Speaker Pelosi, led us to pass a $3 trillion package. And there are some people who didn't want to do that at all. There are some people who want to do less, but you have to realize when we talk about the kinds of things we're talking about here today, about making sure that our communities are protected against the virus, it's the $1 trillion in local funding that goes to pay for our EMS workers, our firefighters, and all our other people on the front line in every community around America. So when you hear people say, well, that's too much money, remember that less money means more help for the very people that are saving lives every day around this country. And, Domingo, it was about a month and a half ago that Vice President Biden, myself, and other members of Congress joined you in a LULAC presentation with respect to meatpacking workers. And right around that time, we saw this train wreck coming, because we saw in meatpacking plants all around this country of our workers that were being infected with coronavirus. We heard stories from family members of those who were on ventilators, those who had died. And we thought that it would be over soon, but it's not. Now in communities like mine, where people are getting infected at a 31% infection rate, it's all happening because our federal and state leadership failed to act at the right time. And now people are dying because of it. And so one other thing that I've begun to think about, one of the things that we are really experiencing in this country, and Dr. Ruiz and Dr. Rodriguez can really talk about this, because Congressman Ruiz has a public health background himself. But what we are seeing in this country is a real failure in the way this administration is using the public health service. Dr. Ruiz traveled from California to Brownsville about a month ago to volunteer to work in the ICU units there. And what he relayed to me is an experience where there were 50 people in that hospital on a ventilator with only 2 ICU doctors to take care of them. And fortunately, he came in to help them. But at the same time, in his hospital in San Francisco, there were 25 ventilator patients, half the number that there were in Brownsville, but 50 critical care doctors. And that's what the public health service, in my view, is supposed to do. The federal government should step in situations like this and make sure that we allocate our resources where they need to go. And as this pandemic ravages the country and our Black and Latino communities, but also in rural communities all across this country, those are the kinds of things that Biden-Harris leadership that we're going to be able to count on when we have the leadership that we hope to have when November comes around. But anyway, I want to thank all of you for having me. Dr. Biden, you're so gracious with your time. It's a pleasure to be with you on this panel as well.
Happy to be here.
Thank you, Congressman Vela. Also joining us today is Amirah Sequeira. Amirah has worked in healthcare advocacy for more than a decade. Amirah joined National Nurses United in 2016 as a legislative advocate and has served as the organization's lead legislative advocate since 2019, spending her time in the halls of Congress, advocating and fighting for patients, nurses, and the health of the American people. Ms. Sequeira also served as the national coordinator for the Student Global AIDS Campaign. She graduated from Columbia University in 2012 and received a master's in history, philosophy, and sociology of science, medicine, and technology from the University of Cambridge in 2015. That's amazing. We are so fortunate to have her today. Amirah, welcome, and the screen is yours.
Thank you, Congressman. I'm so grateful to be here in community with you all today and deeply honored to be in this discussion with you, Dr. Biden. It's great to see you again.
Thank you.
National Nurses United and the 155,000 nurses we represent are so grateful for the leadership of former Vice President Biden and of the campaign in fighting for what our nurses need during this pandemic. Congressman Vela, it's great to be with you again. So first, I bring greetings on behalf of the nurses across this country that NNU represents. I bring greetings to LULAC, to all of your members today on behalf of our presidents and the executive director of National Nurses United. National Nurses United is the largest union of registered nurses in the country. And our nurses have been on the front lines of this pandemic since day one. This discussion that we're having here today is extraordinarily important as we confront the huge health disparities that COVID-19 is exposing across Latino communities across the country. One of the reasons why we are seeing higher rates of infection in Latino communities is because of the essential workers and who makes up the essential workforce in our country, and because of the failure of our employers, of this administration in Washington, D.C. to protect essential workers across the country. So I'm very grateful to be in discussion with you here today. Thank you.
Thank you very much for your words and for your very, very strong energy. Thank you so much. Now, next, I would also with us today is Dr. Robert Rodriguez, who is the Residency Research Director of the Department of Emergency Medicine at the University of California, San Francisco. A native Texan, go Texans today. Dr. Rodriguez has trained across the country. He attended Notre Dame University for undergrad, Harvard Medical School, and completed a combined emergency medicine and internal medicine residency at UCLA Medical Center. He later completed a 2-year critical care fellowship at Stanford Medical Center. So he is certified in emergency medicine, internal medicine, and critical care medicine. And recently, Dr. Rodriguez has been working on the front lines of the COVID-19 pandemic. Dr. Rodriguez, thank you for being here today, and I invite you to say a few words.
Yes, thank you. Thank you, Congressman Ruiz. I really appreciate this opportunity to address this critically important issue. I want to thank Dr. Biden, Congressman Vela, and LULAC especially for inviting me and for tackling head on this important topic. As you indicated before, I have two places that I call home. I currently live in the San Francisco Bay Area where I work and live, but I also claim the border city of Brownsville, Texas, where I grew up alongside Congressman Vela, and I have a huge extended Latino family down there, lots of friends. I consider that my deep-rooted home. In both places, I've seen firsthand how the COVID pandemic has devastated Latino communities. I work in an ER and an ICU in two hospitals in Oakland and in San Francisco. And at both hospitals, the pandemic has severely affected the Latinx communities. Despite comprising only 15% of the population in San Francisco and Oakland, over 60% or about 2/3 of cases are in Latinos, and over 2/3 of the deaths are in Latinos. So this issue is truly a generational issue. It's a medical crisis of our times. And first and foremost, I think that we need to address this topic seriously. We need leadership that will take it on and not minimize the pandemic. We need people that are going to head on and come up with practical solutions, real-time solutions, instead of magical wishful thinking that it's going to magically go away. So I thank you, Dr. Biden. I thank all of you. I thank Dr. Vela, Congressman Vela, Dr. Ruiz. I thank you for inviting me. I thank you for listening to us, listening to us on the front line of the pandemic. We really need your leadership, and I'm proud to be on this panel.
Thank you very much, Dr. Rodriguez. You know, as the son of farm workers, I grew up here in my district in Coachella, California. And so this issue of health equity is very dear to my heart. And I see it with the lens of someone who grew up in a trailer park and farm worker community. My older brother was the first to graduate from high school in our entire family, the first to go to college as well. And I see it as a person who's made fighting for health equity and health disparities and for the health of all Americans and to reduce health disparities throughout our country as a mission. And so this is something that I've carried from the fields in the trailer park to the halls of UCLA to getting my medical degree at Harvard, my public health degree there as well at Harvard, and my public policy degree at Harvard, and coming back home to this trailer park community to start doing my public health work, working as an emergency physician here at one of our local hospitals. And so that impetus, that mission, that dream, that little semilla de sueños, that dream, that seed of dreams that was planted in my heart and my mind through my faith and my family and our community is what's making us right now come together to really address this pandemic. And that's exactly what Dr. Jill Biden and Vice President Joe Biden have done and continue to do. We are 6 months into this unprecedented public health crisis. 6 months. Over 5 million Americans are infected and 1,000 Americans are dying from COVID-19 every single day. For those of us who have lived, seen, and worked on the ground to reduce health disparities firsthand, the fact that the coronavirus has disproportionately ravaged communities of color, particularly Black, Latino, Native American communities, is not very surprising. There are really 4 foundational pillars that contribute to these disparities. So Latinos are at higher risk of getting infected with COVID coronavirus due to being essential workers in locations that do not have the resources and do not allow the proper precautions to take place. Latinos are at high risk of dying from COVID due to the pre-existing disparities and underlying chronic illnesses like diabetes, asthma, cardiac disease that precisely render someone more likely to die from COVID-19. Latino communities are at higher risk of spreading coronavirus to their families and friends at home, because once they are at higher risk of getting it in the workplace or outside, they come home often to overcrowded housing. I know this. I grew up in a trailer park with farm workers. And so oftentimes there's 3 generations living in a 2-bedroom trailer, a 2-bedroom apartment, or a 2-bedroom low-income housing for the working class poor Latino families. And Latinos are at highest risk of having fewer resources like targeted testing, tracing, quarantine location in order to keep them safe from coronavirus. So that is what the public health data shows and what I've seen on the ground. And I've gone out personally into the hardest to reach areas with homeless, as well as the farm worker trailer park locations to conduct testing. I'd like to hear from all of you about what you're seeing on the ground and what all of you are experiencing, with the idea of first being, we need to identify the problems in order to accurately apply the proper solutions. So we'll have a conversation about the problems moving towards what we need to get done. So I will ask the panelists to please keep your remarks to about a couple minutes to allow for a thorough, engaging conversation. Anybody can speak up. We're Latinos, so we're very passionate. We're going to be animated and speaking strong here with our thoughts because we care very much about this issue. So first, Filemon, Congressman Vela, your district.
Go ahead, Raul.
Your district has been one of the hardest hit. We're seeing on the national news how Brownsville has been a hot spot. And so I want to hear from you on the ground from Brownsville area. What's the experience? What are you seeing on the ground?
Raul, it's been a ravaging experience. You and I both had to be in Washington, D.C. during the month of July because we were in session. I left Brownsville, Texas, and I drove with my wife on June 23rd. When I left, I knew nobody with COVID. Within about a week, things began to get really, really difficult and really, really scary. Today, I can tell you, the number of people that I know with COVID is in the hundreds. And one day, I knew 4 people who had died. It was at one point during that crisis that I called Dr. Rodriguez in California because I knew that we needed help, and he volunteered to go down there. And I think that given the limitations of time here, that it would be that hearing from him on what he experienced, because he was on the ground treating those patients, it would probably be worthwhile.
Great. Well, I'll turn it over to Dr. Rodriguez. What was your experience in Brownsville when you went to go assist?
Yes, Congressman Ruiz, it was the hardest experience of my life, the hardest work in my 30-year career as an emergency physician, as an intensive care physician. I came to California. We've had a slow, steady stream of cases in the Bay Area. There have been areas like Los Angeles that have been hit a bit harder, but nothing like how Brownsville is affected. I flew down there, and the next day I was in the ICU treating the sickest patients that I had ever seen in my career. And the hospital was, all the medical community there, the doctors, the nurses, the respiratory therapists, they were working extremely hard. They were working night and day, but they were simply overwhelmed with the sheer number of cases. They had to open up various ICUs that were just to accommodate the patients. At the time, about 5 times the number of cases in the ICU there as compared to my hospital, which is a much bigger hospital, a much more resourced hospital. So it was a very eye-opening experience. It was, again, heartbreaking. I, like Congressman Vela, lost 2 friends in a nearby ICU in South Texas while I was down there. It was really gut-wrenching, and I commend all the doctors and you, the congressman, for trying to get help. But I think it was just a devastating experience.
Well, Dr. Rodriguez, I think we should commend you for, what you did with traveling down to Brownsville. I've been there, like Phil said, and for really giving of your time to help these people. And I think the most heartbreaking thing is it didn't have to be this way. It didn't have to be this way if this administration had acted much more quickly and had provided the materials that our frontline workers needed, and had gotten, had taken it seriously, and if our president had said, we should be wearing masks and social distance. So that's the really heartbreaking thing, and that's why, Joe and I are working so hard, because I think it's leadership that makes all the difference. And I think if Joe, in a Biden administration, I'm not saying that the pandemic wouldn't have happened. It would have, but it wouldn't have this number of devastating deaths. And we could have prevented so many lives from being lost. And it's just heartbreaking. It's just heartbreaking.
One of the, and I absolutely agree with that. One of the nightmares scenario that a healthcare professional has is wanting to fulfill their professional and moral and life mission of taking care of others without the equipment that they need in order to protect themselves. So when we talk about capacity expansion, oftentimes we're focused on numbers. We look at the number of ICU beds in a hospital. We look at the number of ventilators. But what we don't think about are the resource, the human assets, the people on the ground that are working day in and day out. And it doesn't matter if you have 100 more ventilators in your hospital. If your nurses and your doctors are fatigued and exhausted, and you don't have enough people who are healthy enough because some of them are quarantined to manage those ventilators or take care of those ICU very intense patients, then you're going to have cracks in the front line. So I want to ask Amirah, what was one of the biggest issues that nurses have been facing, and where do you pinpoint that at in terms of the anxiety and the stress that they're experiencing, and what would you do differently?
Thanks, Dr. Ruiz. So first, Congressman Vela, Dr. Rodriguez, I just want to give you my condolences on the losses of your friends. And I think what you just shared with us is a testament to the fact that in brown and Black communities, we are all touched by this because our communities are so deeply affected by this pandemic. So, Dr. Ruiz, across this country, we represent nurses across the country. Nurses do not have the personal protective equipment that they need. And, we talk about the essential workers, these essential workforces as being high risk, highly hazardous jobs. They don't need to be so hazardous, right? We have the tools. We have respirators like N95s or PAPRs, powered air purifying respirators. We have gloves and coveralls. We have head coverings and shoe coverings that can protect the nurses to ensure they are not exposed. And what has happened is across this country, we did not have the supply of the N95s, the other respirators, and the other PPE that we need, number one. And unfortunately, the president has continually refused to fully invoke the Defense Production Act to increase the production of that PPE. That's one problem. The second problem is we don't have national standards to ensure that employers, not just healthcare workers, not just healthcare employers, but also food service employers, grocery stores, transit workers, that they get the protections they need in light of an emerging infectious disease. Workers across this country have been begging for the Occupational Safety and Health Administration to issue an emergency temporary standard so that in an emergency situation like this, employers have a guideline for what to do to ensure that there are adequate isolation protocols, adequate personal protective equipment protocols, but we don't have that. And lastly, so we don't have the supply, we don't have the standard, but also we haven't had a coordinated supply chain system to ensure that the supplies we have are distributed adequately. And so as a result, as Dr. Rodriguez mentioned, this has put immense strain on nurses. I would just point out to you, more than 230,000 registered nurses in this country are Latino. And these nurses are living in daily fear of exposure to the virus. Many are not seeing their children. They're not hugging their children. They're not hugging their spouses. They're isolating from their families. But if you're a nurse and you're a single parent, you might not have that option. So you're living in fear that you're exposing your children, your communities. And this is putting just an unbelievable amount of stress and anxiety on our healthcare professionals, as it is on other frontline workers.
Well, you know, Amirah, I mean, this would not happen in a Biden-Harris administration. I mean, when we were in office with the Obamas, you know, we had an office of pandemic and a strategy to handle these pandemics. And so going forward, when Joe is elected, we will have an office of pandemics. We will have national standards, because this is just, it's horrible. I mean, what we're doing to the lives of these nurses and doctors who are on the line. And it's just unconscionable what's happening.
And those words give us immense hope. Those words give us immense hope, because one of the things we'll have with the Biden administration is what we've been lacking. We have the resources, we have the scientists, we have the infrastructure. What we don't have is leadership. And leadership in crisis situation is pivotal. As we've seen the lack of leadership with misinformation being given, disinformation being given, in the lack of crisis communication, meaning credibility, being concise, being consistent, making sure that we listen to our scientists, then we see that that has repercussions. It didn't have to be this way, in the words of Dr. Biden. And so I want to ask Dr. Rodriguez, how important is accurate information for your patients, for the people on the ground, to take the necessary precautions? And what have you been experiencing on the ground with all the misinformation that's being sent out from the White House?
It's absolutely critical. It's absolutely critical that we have accurate information, that we have leaders that listen to the scientists instead of conspiracy theorists and promoting absolutely ineffective therapies. We need leadership that listens to the scientists, that promotes things that actually work. And so when we see people not wearing masks, and leadership not promoting the wearing of masks and not promoting the therapies that work, it hurts us. They're really hurting the frontline providers. They're hurting the communities. It's just not helpful at all. So we really do need somebody that can, again, listen to the scientists, to provide accurate, up-to-date information, and truly lead, instead of just trying to wishful thinking make this go away, because it's not going to go away. We're going to have more hotspots throughout the fall and winter. And what I believe needs to happen is we need to set up COVID rapid response teams, which would consist of doctors, nurses, respiratory therapists, who are set up on a federal level, a national level, or perhaps regional level. And they can be set up ahead of time and go to these areas of crisis like Brownsville. They can help out in those communities. This COVID rapid response team could save tens of thousands of lives.
Yeah.
It would help the communities in real time. You can't wait for a crisis to hit a particular spot and then try and send in people later on. That just doesn't work. You're gonna lose many lives that way. We need a structured, systematic way, various teams of COVID rapid response teams to be set up ahead of time and be able to go to the various areas that sprout up with hotspots. And that needs to be done nationally.
And won't it be nice to have a president who actually believes in science and makes his decisions based on evidence? So that's the difference. I mean, Joe Biden will make strategic decisions and carry through. He will have the strategy and the foresight to make sure that, Americans are taken care of. That has to be his number one priority as a president. And we're just missing all that. We're missing all that right now.
I'm thrilled to know that the Biden plan includes a substantial amount of resources to create a public health workforce, specifically, as Dr. Rodriguez was describing, that we needed in order to address the rapid response, address the community level care that we want. And so there's a lot of need, and the solution has already been described and laid out. I want to ask Congressman Vela to help us understand the nuances within the Latino community and in terms of the chronic lack of access to care, the high cost of medications, the lack of communication in a language that many Latinos could better understand, and how that has played an impact during this pandemic, and where do you see us needing to move forward from here?
Yeah, I mean, I think in Texas in particular, we did not expand Medicaid. So there are thousands and thousands of people that are uninsured, that because they can't afford to go see a doctor, they wait until they are so sick that it's difficult for doctors like you and Dr. Rodriguez and the nurses that work in those hospitals to even save them. I think that's something that Dr. Rodriguez saw firsthand. Just yesterday, I spent an hour with medical providers from our local community health centers, and they were explaining what a difficult task it was for them to communicate with their patient base as the pandemic hit, and in particular as the rates of coronavirus infections grew in our community, because all of a sudden the patients that were used to coming in and waiting in line out in the waiting room, they could no longer do that because everybody was stuck at home. So then they had to very quickly set up a system so that they could reach out by via telehealth, right? But setting all that up took time. And then on top of that, you had this tremendous fear that people had even going in once they felt sick. What's going to happen to me when I go to that hospital if there's so many coronavirus victims there? And so there were all these obstacles, and I really do believe it starts at the top. And had we had a robust federal response from the beginning. Well, first of all, had we had a robust federal response back in March, we probably never would have gotten to this point. But now that we're at this point, a robust federal response so that we can do the kinds of things that Dr. Biden and Dr. Rodriguez are talking about. So if you have a hot spot, you know that it's coming, and we're set up ahead of time to make sure and do everything we can to mitigate the effects of the disease.
Thank you. Thank you. And so, Dr. Rodriguez, what if there were some things that we could do immediately to really help you in the emergency department take care of your patients better, or to help ease the load of patients in the emergency department? What would that be?
So I think that the first and foremost, we need a immediate ramping up of our testing capability, rapid testing capability. Our current system, our current testing capability is completely inadequate. Take for example, imagine I'm in the ER taking care of, let's say I have patients who have symptoms that could be COVID, but they could also be another type of pneumonia or something else. I'm trying to make that diagnosis of COVID, and I only have 2 available rapid tests, which can be the case and is often the case in our ERs. So who do I give those 2 tests to? And what do I do with the other 8 patients whose test is going to come back 12 hours, maybe even a couple of days later? You know, how do I tell them to isolate? How do we accomplish contact tracing in those patients? It all comes down to greater availability of testing. And I do want to make one other point, which is relates back to fear of coming to the emergency department. And I want to point out that another factor that has hit our immigrant communities is the fear of the medical system in general. And that a lot of this fear has arisen because of rhetoric by the current administration, political rhetoric by the current administration. We published a study last summer that demonstrated that anti-immigrant statements by the president have induced safety concerns throughout Latino populations and have hindered their presentation to emergency departments for care. It makes them afraid to come to the emergency department for care. So we need to push back against that political rhetoric, that anti-immigrant rhetoric, and make it clear that that Latino patients of any type can come to the emergency department without fear of being arrested. We're not going to report them to immigration authorities. We need to push back on that sentiment, because that has affected, that delays them coming to the emergency department. That makes them afraid to come in for another reason.
You know, this pandemic has really brought to light how interdependent and how intertwined our health is. That it is not a personal commodity, but it is a common good. That we cannot slow the pandemic unless everybody across America has the resources to live safely. That somebody else's health, and that our health is dependent on somebody else's health. And that's not only true during a pandemic, but that's also true as a public health system. Oftentimes in public health policy, we talk about funding and sources of resources on which sector of industry, but we leave out the most important product of a healthcare system, which is the actual health of a population. And how do we begin to devise our plan to create a healthy, productive, and happy population, which would bring down healthcare costs? So since we're talking about these chronic issues, Amirah, you're a legislative specialist on addressing these healthcare issues. Can you talk about what are some policies that we can start implementing to closing some of these gaps, to reducing the disparities?
Yeah, so first, I think everything that Dr. Rodriguez just said is really important, especially for the Latino community. Immediately with COVID, we need to increase testing availability immediately, and we need to do so in a way that is free and easily accessible. If any of you have tried to get a test, as I certainly have, it's a lot easier to do so if you have insurance and if you can afford your copay. We have an immense problem right now where there are tens of millions of Americans, and high rates specifically of Latino and Black and Brown Americans, who don't have insurance. Additionally, there are high rates of Black and Brown Americans who have insurance but cannot afford their copay or their deductible. We need to work towards getting to guaranteed healthcare so that anybody can walk in to the hospital, to a doctor's office, and get the care they need without financial barriers to care. And we also, to Dr. Rodriguez's point, need to ensure that our Brown and Black communities are not concerned about other repercussions they may face legally, especially with immigration, when they need to access healthcare. So I think that is very, very important. But if I can, Dr. Ruiz, I would just also add that in this moment where we are looking at the potential of a pandemic that is going to extend for months more, maybe years, we need to figure out how to protect essential workers. And there are three things that are important. And the HEROES Act, which you and Congressman Vela championed and supported, would address these things. We need the Senate to pass that bill. We need an OSHA standard, an OSHA emergency temporary standard. We need, there is language in the HEROES Act that would fully reform our medical supply chain system that is actually so important, not just for healthcare workers, but for all other essential workers, to get them PPE, to make a medical supply chain system that is transparent, that is comprehensive, and that is effective. And lastly, to your earlier point about information, we need to ensure that the Centers for Disease Control stops weakening their guidances, because the CDC under the Trump administration has consistently weakened their guidances for how employers need to protect nurses and other frontline workers. And as a result, nurses, grocery store workers, bus drivers have been challenging their employers, saying, you are not giving us adequate protection. And their employers are saying, the CDC says the protection we're giving you is fine, when it's not. So we need to address those three things.
Thank you very much. Before we close and have closing remarks by Dr. Biden, I want to tell you a story. The other day I was out at a farm worker trailer park, and I saw a community full of dignity, full of self-respect, full of hard work. People coming in dirty after working long, hot hours in the field with calloused hands and tired backs, oftentimes led by the mom in the family, bringing their children, their parents, making sure that they got the information they need. And this one particular family brought in an 8-year-old boy. His name was Miguel. And I was going to administer the test with Miguel, and I got to know him. He told me he was about 3rd, 4th grade. And so I asked him this very important question that I believe should be part of the medical examination history taking, which is, Miguel, what is your dream? And Miguel looked at me and he said, my dream is to be a nurse. And so I said, okay. So I stopped what we were doing and I made sure everybody, all the medical volunteers, all the staff, all the farm workers, the entire community and their families stopped what they were doing and looked at us. I stood up, I had Miguel stand up next to me, and I said, everybody, Miguel has a dream. And I said, Miguel, mijo, son, I said, what is your dream? And he looks at everybody and he says, quiero ser enfermero. He said, I want to be a nurse. And I said, say it louder, Miguel. And he said it louder. Say it louder, Miguel. And he said it louder. And I said, everybody, let's say Miguel will be a nurse. And so everybody, the community's voice was lifted with certainty, expectations, and power from the soul that we gave to Miguel. And I sat back down and I whispered in his ear and I said, Miguel, if you ever run into any obstacles, any barriers, if anybody ever tells you that because you're a kid from a trailer park, poor, learning English, or because your parents can't speak English, or because nobody in your family has graduated from high school, remember what we just told you. And so when you care, like Vice President Joe Biden cares for our community, then you know that every number is not a number, it's a story, it's a person. And so that's why I'm so excited that Dr. Biden is here, because they care, they have compassion, they've been through life experiences together, that they understand nuestros lágrimas, our tears and our frustration and our hopes and aspirations. And so that's why they're working aggressively, not only on the acute issue of the pandemic, but also on the underlying chronic issue that's led to to the disparities that have ravaged our communities during this time. And so for Miguel, all of us will come together and work hard. Vice President Biden's plan to fully and comprehensively call on the Defense Production Act, so we don't have to repeat the mistake of the Trump administration, to have the testing, to have the masks, to have the gowns, to create a national strategic delivery for mass production and delivery throughout our country, so that people like Miguel can have a test in the hardest to reach places, and to have the chronic solutions within the Biden plan to protect the Affordable Care Act, to protect people with pre-existing conditions like Miguel's mom with diabetes, like to reopen the ACA enrollment, to increase investments in Medicaid, to ensure that no person pays out of pocket for COVID-19 treatment, to increase coverage through a public option and decrease the cost of medications, and double our investments in community health centers, precisely those centers that Miguel and his families goes to get care for. So that is why I'm so thankful that Dr. Biden is here. And that's why I am so thrilled to know that although it didn't have to be this way, and there is a lot more morbidity and mortality, that there is a plan, and there is a leader, and then there is the compassion and the caring and the kindness that we need to get us out of this pandemic as quickly and as safely as possible. And so with that, we are very honored to hear the last words from Dr. Biden.
Dr. Ruiz, that's a beautiful story. And what you did for Miguel, I mean, that he will never forget you. You inspired him, and you gave him a gift. You gave him the gift of confidence, and you believed in him. And that is so important. So thank you for that. That was beautiful, really. And Congressman Vela and Dr. Rodriguez, Amirah, the nurses are the angels. Thank you so much for your thoughts today and for your leadership through this pandemic. And this is a tough time, and we're all having to find our new normal. And we're slowing down, and we're praying for healing, and we're hoping for the safety of our human family. And lately, I've been reminded of the words of Ada Limon. And so, I'm a teacher of English and writing, so you had to get a little bit of poetry. So in the poem, Dead Stars, she thinks about the magnitude of history in the most mundane of moments. When she's taking out the trash. And she writes, quote, "Look, we are not unspectacular things. We've come this far, survived this much. What would happen if we decided to survive more, to love harder? It's easy to feel tired and even defeated when the news every day is so dark. But Limon reminds us that now is the time to survive more, to love harder. And I've always felt that optimism is a courageous act. And I see that especially in the Latino community. And it's why you're all here, to lift up your community, to serve, to survive more, to love harder. So I want to end by saying thank you Thank you for sharing all of your stories. Thank you for fighting for our future. And thank you for your faith in an idea that's bigger than any one of us. And that is that we will build a better nation when we do it together. Thank you. Be safe. Thank you.
Thank you very much. And now I'll pass it over to Sindy for the close.
Mil gracias. Thank you so much, Dr. Biden, to Representative Filemon Ruiz, Amirah, Sequeira, Dr. Robert Rodriguez. Thank you so much for joining us. On behalf of President Garcia, myself, and our LULAC leaders, thank you to our members and our community for tuning in. Thank you to all the featured speakers and panelists for joining us on key conversations impacting Latinos across the U.S., D.C., and Puerto Rico. I also want to disclose that we are a nonpartisan organization, and LULAC did invite key leaders from the Republican Party without any luck or confirmation. I would like to thank our production team as well as the LULAC national staff for all your hard work. Mil gracias, Beatriz, Vanessa, Diego, Jorge, all her policy interns, and the entire LULAC team for making this LULAC Natural Virtual Summit possible. Please join us next year, Primero Dios, on July 22nd through the 25th in Albuquerque, New Mexico. We can't wait to gather again in person. We're hopeful that soon we will see each other. I wanted to end it on this message. We know that our community is under attack. And I just want to remind you of the recent anniversary of the one-year shooting of El Paso, where our ethnicity was used as a weapon against us. We know that words matter and that hateful rhetoric can lead people to drive hundreds of miles to target and kill our community. In 2020, we still have children in cages and detention centers that are COVID-19 hotspots where they are dying. We need your help, LULACers, in elevating this issue. Please make sure to check out the latest LULAC actions and join us in freeing the children. We also know that our democracy is under attack. The census. We see that it's being underfunded by this administration and that the period has been shortened during a national and global pandemic. And our ask to you is that you fill out the census, that you ask your friends and family members to fill out the census, and if they need help, that we help them in filling out the census. It is no coincidence that this administration wants to make our community invisible, that this administration wants to take our power and our influence away from the Latino community. Again, we need your help now more than ever to make sure that our community counted. We also have an important election this year on November 3rd. And let's be reminded that our country and our democracy belongs to the pueblo, it belongs to the people. So please remember that there will be barriers, but we need to double down and remember that our vote is more important this year than ever before. And I know that every single year you hear that your vote matters. Well, in 2020, your vote matters 100 times even more because our community is under attack. And I want to also conclude with these words. I want you to join us by signing up at 1 Million Latinas Strong, which is creating a network of grassroots Latinas across this entire country being led by LULAC women leaders in all of our 41 states and communities, Puerto Rico incluido. I want to end with the words that I have repeated over and over since the beginning of this year, and it's this. Our biggest act of disobedience is to vote. Our biggest act of defiance is to vote. The best way that we can represent our community is to vote. The best way that we speak up and we are heard is to vote. The biggest way that we protest is to vote. Our biggest way to protect and defend our comunidad is to vote. Our biggest call to action in 2020 is to vote. And so I ask you, what will you be doing on November 3rd? Voting. Gracias.